All right. Hey, everyone. Thanks for joining. My name is Dan Vanderzee. I'm with Mathematica, and we will be going through this fireside chat today titled Leveraging T-MSIS Data for Streamlined Modular Certification. And so I'll go ahead and kick us off with our agenda, some housekeeping items, and then we're going to get right into it. So the agenda for today, I will go over housekeeping. Like I said, I will introduce our panelists. We have 3 joining us today, 2 from Mathematica and 1 from Amazon Web Services. And then we'll go through that fireside chat. Just to kind of give you a little background on this event might be a little bit different than what you may have experienced before. We're just really having a discussion with our panelists. We do encourage questions from the audience as well. And so, this is meant to be a little bit like of a less formal discussion. We did obviously have our questions prepared in advance so that we know a little bit about what we're talking about here, but this really is meant to be a discussion and participation from the audience is encouraged. So as far as questions, if you do have any, the chat, you can just submit your questions via chat. When you do submit those questions, they will only be visible to us. So if you do have questions that you don't want everyone to be seeing, they only do come to us, the panelists here. You can also raise your hand. There's a little icon towards the bottom, a little hand raising icon. And if you do that, we can unmute your line and you can ask questions live as well. And we do encourage that at any time during the presentation. If you hear something that you want to follow up on, please feel free to either chat it in or raise your hand. We're happy to take you off mute and bring you into the conversation. We'll also stay on the call until all questions are answered. So if you have questions towards the end, that's fine. We can stay on the event until all those questions are answered. And then after the webinar, we will send out the slides. We'll also send out a recording. A reminder too, when you do close out of the session, there is going to be a post-event survey with 3 very brief questions, just asking about how you felt the webinar went and any kind of follow-up that you may want. Next slide, please. And so I'm going to go ahead and give us a quick introduction of our panelists here. This will be the only part of the presentation that does get read because I will be reading their bios for everyone to get introduced to our panelists here. So first we have Michelle Listug. She is a client engagement lead for Immersis, a cloud-based T-MSIS data quality product that processes T-MSIS data files, evaluating them against CMS's T-MSIS data quality requirements, utilizing the OBA framework used by CMS. Prior to joining Mathematica, Michelle worked for 21 years in the MMIS system development and operations, where she was responsible for system certifications in Mississippi, Alaska, Maryland, New Hampshire, South Carolina, and Kentucky, and system design in many other states. Steve ConCitis worked in the Michigan Medicaid program for about 8 years before joining Mathematica, almost 15 years ago, to work with CMS on the Medicaid Statistical Information System. Since joining Mathematica, he's helped states, CMS, and many other stakeholders with his expertise in the intersection of policy and data to improve the collection and use of state Medicaid and CHIP administrative data. Nick Ertakis is Medicaid leader for Amazon Web Services Health and Human Services team. In this role, he enables Medicaid agencies to improve the Medicaid experience through delivery of transformative technology. Prior to AWS, Nick authored and led delivery-focused federal policies and national oversight as a deputy director at CMS. At CMS, Nick reviewed state T-MSIS compliance as part of the APD processes, as well as Medicaid system certifications, wherein T-MSIS compliance and data quality improvements were essential. Nick conducted data research on the original MSIS files and then supported states to transition to an improved T-MSIS reporting. That's the introduction for our panels. Next slide, please. And Michelle, I'm going to pass this over to you to talk a little bit about what to expect today and how we got here.
Great. Thanks, Dan, and thanks to my co-panelists. You guys are super impressive. So what I want to let you guys know as we begin our chat today is that Mathematica has really been looking at ways to use T-MSIS data for a while now. I mean, the data, it's a great data set. It tells you a lot about the way your system is working, about the health of your Medicaid program. We've heard from other states that they think there should be a way to use that data. So that's really what we're talking about today. We have several things on our radar, one of which is using it to support program integrity, to support CMS 64 reporting. And then the big one, and why you're all here, is because we want to talk about how T-MSIS can support modularity and certification. This particular use case came about for us. The idea was born through messaging from CMS. They've been pretty clear on the role of T-MSIS in certification and modularity. So we really started doing a deep dive into this a while back. We've recently mapped the certification outcomes to the T-MSIS measures. And that's the part we're going to talk about today. So we're going to spend the next hour just chatting about it, talking about our process, just connecting the dots between T-MSIS, modularity, and certification. And as Dan said, this is truly meant to be a chat. It's casual. If you have questions, just raise your hand and we will come to you. So back to you, Dan, and I think we can kick off our first question.
Perfect. Sounds good. Thanks for that background, Michelle. I do appreciate that. So we'll dive into our questions now. And Steve, this first one's going out to you. And I know that many people on the call probably already understand what is T-MSIS, but just so that we have a baseline of what we're talking about here, wondering if you could just kind of talk a little bit about T-MSIS from the perspective of what we're here for today.
Yeah, definitely. Hopefully everybody's at least heard of it. I'm sure everybody's probably more familiar with it than that, but just a level set. So first and foremost, T-MSIS is so valuable because it really is the most comprehensive and granular data set of Medicaid and CHIP administrative data. And there's no other data set that is as specific and as deep and wide as T-MSIS is. So that includes beneficiary level demographic and enrollment data, which also includes third-party liability, provider enrollment data at the provider level, managed care plan specific contract information, and then service specific utilization and provider specific payment data. T-MSIS is reported by all states to CMS, including also DC and several territories. It's updated by states monthly, so it's very timely, unlike its predecessor, MSIS, that was off. It was usually at least 4 to 6 months behind, and now with T-MSIS, we're typically about a month behind. Every once in a while, a state might lag a month or so, but it's very, very timely, especially in comparison to something like MSIS. And on the CMS side, every month when a state submits a new set of files, those files undergo a rigorous data quality assessment. And then for high performing states, as I'm sure all of your states are, often those states are performing their own data quality assessments before they send the file to CMS. And eMRSIS is a perfect example of a tool that does that for states. And then last, on the back end, there's thousands of users of T-MSIS data in either T-MSIS form or T-MSIS analytic file form. And that includes federal government, state and local governments like yourself, and then commercial entities and academic researchers. So hopefully that's a good round description of T-MSIS for this audience. Happy to answer any questions if anybody's not familiar.
It's a lot to fit on a bumper sticker, but I think you captured it real well.
Yeah.
There's no other additional questions here. I'll just kind of move on to our next one, kind of getting into the meat of this. Michelle and Nick, this is kind of for you. I'll let you fight over who wants to answer it first. But just looking at like what is the MES certification process? What does that look like? From Michelle, your perspective. Nick, you may have a different perspective. So sending that out to both of you, Michelle. I'll let you start here.
Great, thanks, Dan. So when we're preparing for webinars, like anybody who prepares for a webinar, we're constantly watching our registration list. One, is anybody interested? Who's going to be there? You know, are we delivering something that's important to this Medicaid community? So over the past couple of weeks, I've been looking at our registration list, and what I realized is there's not a person on this call who is not intimately familiar with certification. I don't think I have to tell anybody on this call what that is. We all know the role that certification plays in our Medicaid system. We know that it's linked to funding our FFP. We know that the source of truth for the process, of course, is the MES certification repository. It's a great resource for all of us who are in the weeds with certification and people like me who are kind of on the periphery now. What I would like to tell you is a little bit about how I feel about certification and how I've seen it change over the past 25 years. Because as Dan said, I've been involved with certification for a very long time. The one thing I think we can all agree on this call is it is very stressful. It is a very, very stressful process. A lot of work has gone into system development, system planning, teams working together, testing, pushing a new system out to operations. Years of work, literally years of work, and a lot is riding on certification. When I, literally in the year 2001, when I was first in this industry and was working on the Mississippi Medicaid project, certification looked very different. It was very, very different. What wasn't different was the elation that we all felt when we got that system certified. Fast forward to when I was working on the Alaska project, and certification was different then. It was still just as intense. It was still just as thorough and still just as important. But on that project, years, 6-7 years down the road from Mississippi, we started working on certification as the vendor when we started tracing the requirements to the system design. So we had the certification requirements that we were going to have to adhere to as part of our design every step of the way. Fast forward then on to when I was working on South Carolina and Kentucky, and that's when we saw the change to Streamlined Modular Certification. And I will tell you, as someone who's worked on this for many, many years, I really think this is the best process. It's so easy to see the thought that has gone into this, the best parts of the other processes brought into Streamlined Modular Certification. And I think we all in this industry benefit from that. It's very important. It's worth discussing as a community. It's worth reminding ourselves through that MES repository of what the requirements are, and are we all familiar, whether we're some of these people I see on the call who are trying to get system certified, or people like me who are working to support those activities. We think, as I've said before, there is a natural relationship between these metrics that you're having to report for certification and your T-MSIS data, and the metrics in the T-MSIS data, which clearly is a very detailed view of the health of your system. And I think if we look at the certification requirements, the outcomes, the metrics, we could all probably, share that opinion about the importance of T-MSIS with certification. So Nick, I didn't mean to take all the time, but let me turn it to you.
I mean, no, you said it well, and honestly, I'm very happy to hear you say that. I know the CMS team worked very hard on getting SMC published and out, and frankly, based on direct state input and this idea of data-driven decisions. When I was there, we and Eugene and all of the folks that were building out the pilots for SMC, there was a direct comparison between the old school MECT and MEET and what SMC looked like. And it was, massive double digit. I can't quite remember. It was something like 87% or a high number like that of reduced data, like metrics that had to be captured, all while keeping, so you're like streamlining a lot of the processes, but while keeping the most impactful part, the outcomes that the module, the system needed to do, and then that metric and data that supports that. And so when I say like there was this reduction, it was a reduction in processes is really what it was, from MECT and MEET to SMC. And that's what I know the CMS team worked really hard to do. I'm really happy to hear you say that. And I think that has also continued. I know the state officer team is really connected to states and looking towards those opportunities to, well, how can we streamline it? How can we reuse? How can we take advantage of what is out there to continue to make this process better? Because I think one of the things that changed frankly, with the SMC release was that not only was it everything SMC, but a real deep connection between CMS, that state officer team, and the states throughout the certification process, so that they could be engaged from day one all the way through certification and help crafting those outcomes, sourcing that data, vetting it. I mean, all back to what Michelle said, to try and alleviate some of the stresses associated with it, right? Make it a journey that the states and CMS can go on together. So yeah, that's my 2 cents there. Dan, I can pass it back to you.
Yeah, I guess this question kind of relates, right? Is is T-MSIS data used as part of the MES certification process now? What is that looking like in the current state?
Yeah, I think that's a good question, and maybe one of the best ways to connect the dots today. As I mentioned earlier, at Mathematica, we've been looking at the connection between T-MSIS and certification for a while. And we did that because of the information that was being disseminated from CMS and is still being disseminated from CMS. So I pulled a couple of sources that I want to just give you some very high level sections of, to help us all realize how T-MSIS is already connected to certification. So the first thing I want to mention is the State Medicaid Director's Letter, SMD 22001. And in that letter, CMS indicates that one aspect of the conditions for enhanced funding is that CMS coordinates with states to use existing data sources and reporting systems, such as T-MSIS, to avoid redundancy and minimize administrative burden. And that's what Nick was just talking about. How do we use what we have and reduce burden on states for reporting? That letter goes on to say that states must demonstrate that the system/module for which they are requesting certification complies with the most current T-MSIS requirements. Dig on down deeper into this multi-page letter, and it reads that the certification request letter, that's what we have to send when we're ready to get that certification. So that letter should be accompanied by evidence that demonstrates the system is properly prepared for the certification review process, and provide proof that the system and module that is requesting certification is working as designed, and attached to that is the most current T-MSIS results for that state. So here, twice now, we see that T-MSIS is a reliable data source and is being reviewed. Your T-MSIS report is being reviewed and is being considered as part of your certification. Another document that I want to mention here is the CMCS Information Bulletin, CIB 052423. And in that, CMS states that evidence from the certification metrics that the state collects and reports are continually evaluated by CMS to determine if the system is achieving the identified outcomes. So we want to get certified, and we know in this certification, Streamlined Modular Certification, we now have to do monthly reporting. So this is what this bulletin is talking about, that ongoing reporting, and the fact that CMS is reviewing that. Again, here's the statement: CMS will coordinate with states to use existing data sources such as T-MSIS to avoid redundancy and minimize administrative burden on states. They go on to end that letter with the fact that states must meet all federal reporting requirements, such as T-MSIS reporting. So this is just 2 letters here, and just 2 very small sections of each of these letters. And you see the focus is definitely on T-MSIS. One focus is on T-MSIS. It's much broader than that, and I would invite you to read all of the bulletins in those letters. And finally, I just want to end with the last one that came out just a few weeks ago, maybe 2, and that is the state health official letter. We call it the show letter number 25002. And in that letter, states were reminded that eligibility for enhanced FFP, you cannot go work on one single state Medicaid program without hearing that word, FFP. States have to rely on that funding. Of course they do. That enhanced funding is so important. So the eligibility for an FFP for Medicaid eligibility systems, the expenditures for those systems require states to meet federal reporting requirements and maintain compliance with federal T-MSIS regulations. So what I want to mention here, I started with documentation and messaging that went out in 2022, and here we are in 2025, 3 years later. The message is the same. T-MSIS data is very much linked to your certification activities. So yes, it is already a part of the certification process. Let me take a breath and get Nick's input too.
I mean, exactly right. Very thorough. I'll give a little context here. So every certification that I was part of as a federal employee at CMS did a deep examination of the state's current T-MSIS submissions, right? So we certainly looked, if we were doing meet and MECT, we were looking at not only all of the stage gate reviews and all of the associated artifacts there, but the current compliance was definitely examined. Same thing is true with SMC when I was a part of those. And so we would look and get an understanding of that, the current T-MSIS data quality and reporting capabilities. And frankly, you know, there was an expectation that any new module, any enhanced system enhancement that was coming in would improve T-MSIS data quality or reporting capabilities in some way. Now, sometimes that you know, you're improving your claim system, but the data quality issues were with eligibility information, right? So like that was maybe a status quo. There wasn't a huge change happening, but it certainly couldn't go the other direction, right? So like any new module that was being turned on and certified, at minimum, that same level of data quality had to be maintained. And if it wasn't, like that was definitely a reason for deep examination. I would also then say, and I want to throw out one more point of specific guidance. So page 8 of the SMC Streamlined Modular Certification Guidance document actually specifically calls out T-MSIS and says in the paragraph there, they're talking about the evidence from the metrics that are collected and reported will be evaluated whether the system, to determine whether the system is achieving identified outcomes, right? Metrics used to identify if the system is achieving outcomes. It then goes on to say that states will continue reporting those metrics, just as Michelle referenced above. So that's both for the go live of the system, the certification, but then that ongoing reporting. And then right there, it says CMS will coordinate with states to ensure to use existing data sources and reporting systems such as T-MSIS and the Medicaid and CHIP performance indicators to avoid redundancy and minimize administrative burden wherever possible. Like there's a direct quote there that specifically says, hey, like these metrics that are part of the SMC guidance in an effort to minimize administrative burden and reduce redundancy, if that data is there, use it, leverage it. And when I was at CMS, that was what I was talking to states about and pushing. And I also just want to acknowledge that like the operational reporting that is associated with the streamlined certification process, that is additional reporting. Like there's no beating around the bush there. Like it is additional data that in the workbook that has to be submitted. But with this call out and where that data already exists, like leverage that, use that. This is a don't reinvent the wheel. And but what's interesting here, and I think the legwork that the Mathematica team has done is connected the dots, right? Because when Steve was talking about the depth and the width of T-MSIS data, one thing it doesn't exactly do is like speak directly back to the outcomes of the systems, right? You can derive that, you can source that, but it takes a bit of work. And I think that's the impressive part about what the team here has put together and are pursuing is they've laid that groundwork, they've mapped out that content, and there's an avenue to now take advantage of that. So you're not necessarily looking at a mountain of T-MSIS data and then having to figure out, geez, okay, how do I go from there to using that in my operational reporting there? So that's a direct tie, direct quote. We can definitely make sure folks have links, but this is all on the publicly available SMC guidance information that is on the CMS website there. But okay, a little bit of extra color there, Michelle.
Thank you, Nick. Thanks for pointing those things out. The continued reporting, I think, when I first heard about Streamlined Modular Certification, the continued monthly and annual reporting was kind of eye-opening for me. And I thank you for making that connection between these metrics that states are already getting through T-MSIS and being able to rely upon that for reporting. I'm taking too long, so let's go on. Sorry about that, Dan.
Not a problem at all. That's what we're here for. So I'm actually going to move into, Nick, you were talking about mapping of T-MSIS measures and SMC outcomes. So I'm going to jump over to you, Steve, now, so you can chat a little bit about your work in that and how you did map T-MSIS measures to SMC outcomes.
Yeah.
I think that was all a perfect setup and segue because it really was all about just connecting the dots. A lot of the work's already been done on both sides and just a matter of connecting them. So if you look at the Streamlined Modular Certification outcomes, look at the recommended metrics, look at the source, the regulatory sources, they look very similar to T-MSIS data quality measures and the regulations that T-MSIS data quality measures are based on. So they're both the outcomes and the T-MSIS data quality measures. They're based on statutes, regulations, industry standards. So, for example, there's the SMC outcome that refers to the federal Medicaid regulations that stipulate the requirements for collecting and verifying SSNs. And likewise, no surprise, there's a T-MSIS data quality measure or several measures that assess the presence, validity, and verification of SSNs in T-MSIS. So just a matter of connecting those dots. The T-MSIS data quality measures were designed assuming that all of the state's MES modules were fully operational and compliant. So anything that they detect is going to be a T-MSIS data quality issue. For example, again, with the SSN example, if a state triggers a warning for a T-MSIS data quality measure, for an unusually high percentage of invalid SSNs, then we assume that the SSNs are probably valid in the MES module because the MES module has been certified to show that that's working properly. So then we assume that the SSNs have been corrupted somehow in the transport to CMS via T-MSIS. But on the other hand, if an MES module is not yet fully operational or compliant, or if we need to test whether it is, then the T-MSIS data quality measure might reflect the MES design or operations issue. So there's a lot of potential there to use these T-MSIS data quality measures for both purposes, depending on the context of the state's Streamlined Modular Certification at the time. So to connect those dots at a very high level, the starting place of trying to connect those, which side do we start from? I started quickly on the T-MSIS data quality measure side and seeing that there's 2,500 active T-MSIS data quality measures across, at the time, the 8 T-MSIS file types, which of course now there's a 9th for the new financial transactions file. That's a lot to go through, a lot to start with, so looking at the MES modules and certification outcomes, there's 120 Streamlined Modular Certification outcomes, as you're all aware, and those are across the 10 MES modules. That's a bit more manageable to start with. So that's where I started. And then I looked for the outcomes that could be supported by T-MSIS, meaning that the outcome can be certified in part or in whole by data already collected in T-MSIS. And what we found was that 34 out of the 120 outcomes could be supported by T-MSIS. So that's about 28% of all of the MES or SMC outcomes that could be supported by T-MSIS with existing measures or new measures.
Steve,
Yeah.
when you say supported, that those supported, can you talk a little bit about what that means? Like, does that mean does that cover it entirely, or is there a part of it that would help?
Well, and that may be above my pay grade in that, that might be a conversation with CMS. You could propose, this is the set I'm going to use. I can't say that CMS is going to approve that. That's, part of the process. But at least partial coverage for sure. And in some cases, probably enough to satisfactorily, cover the entire outcome.
That makes sense. Like, it's at least enough to put on paper, and then a state could and should take that to their state officer and be like, hey, I think this data, just like they would from if they had to source that data internally, they have to bring that and say, this is the data we want to use for this metric, but now it's an existing data source that they could then bring forward, right?
Absolutely. Yeah.
Awesome.
And the CMS metrics, those are recommended metrics. They're not required metrics. There's the possibility for states specific metrics. So, states might, pick certain T-MSIS data quality measures that speak to their program more than other programs even. So a lot of room for matching there.
So
This was, yeah.
Two points I want to add to that. Steve, that's exactly what happens during SMC. States can say, this is my evidence, these are my metrics, and CMS can accept or deny that. Of course, that all happens before the metrics are being submitted and reporting upon. I mean, it's a decision process. So that's no different than what we're talking about with T-MSIS. Another thing I want to broaden your point on, there were over, keep me honest here, like 1,200 T-MSIS measures that map to those 28 outcomes, correct?
Yeah.
So when
Correct.
you talk about granularity in reporting, and that is what those metrics currently are about with Streamlined Modular Certification, you've got over 1,200 T-MSIS measures reporting the metrics of, is your system working as designed? That is granularity, and you already have it right there in your lap. So I just love that reverse connection of it because it's pretty impressive.
Yes, There are certain outcomes where there are just a lot of TMSIS data quality measures that map to those. And that doesn't necessarily mean that there's an outcome that only has a few measures that, it doesn't mean that that outcome is less covered.
Right.
That, some of the outcomes are very, very specific. I'm using this SSN example. That's a perfect example. It doesn't take a lot of measures to verify that SSN verification because it's a very, very targeted, very narrowly defined outcome. So it doesn't take a lot of measures to cover that.
Thanks, Steve.
Yep. So I do want to mention the limitations here too, though. It's there's the other what is it 86, I think, if correct my math, that we couldn't map to. And so it's tempting to reach for tenuous relationships, but we're trying to stay disciplined and not reach too far. So there's certain outcomes where the TMSIS might tell us that the data needed to perform the task to satisfy an outcome exists. So, the data, it can tell us if the data exists, but it doesn't tell us if the task that the outcome is focused on was actually performed. So we really tried to focus on whether we could actually verify that the system is doing what the outcome expects it to do. And so if it can actually verify that a task is being done, then we can't use it for that purpose. But then there's also some that are just completely outside of the bounds of TMSIS. So there's like the provider management module, the PM16 outcome is about generating relevant notices and communications to providers. Again, TMSIS can't.
Not going to be in TMSIS.
Yeah, there's no indicator for those kinds of communications in TMSIS, and there's a similar one for the eligibility and enrollment module about communications, and there's also the eligibility enrollment outcome 27 is about appeals against adverse action, and so TMSIS isn't going to have information about appeals process in TMSIS, so it can't cover that one at all.
I want to insert one more time, Steve, because I don't want to take too much time because I really want to get to that detailed mapping example that you're going to show. I want to say, let the group know that we are aware that there are state-specific outcomes that you can develop for yourself. We are not blind to the fact that there are only required outcomes. I want to also say that at Mathematica, we have developed state-specific measures. Some of our colleagues from New Jersey are on this call, and not too long ago, well, a couple of years ago, they asked us if we could develop some New Jersey-specific measures because they wanted to look at something very specific in their system. So we can do that. So for those areas where there are not existing measures, or those areas where you may have state-specific outcomes, the potential is there to develop new measures specifically for your state. So let me go back to you, Steve. I'm sorry. I just wanted to get that in.
Sure. And I've spent too much time already on that first part about identifying outcomes that the TMSIS could support versus ones it can't support. So moving on to the next step in the process, after we've identified the outcomes that TMSIS could support, then again, we kind of go through them again in even a greater level of detail and systematically reviewing that subset of outcomes and looking for then trying to connect those dots over to the TMSIS DQ measures. And that could be based on the outcome description, the recommended metrics, or the regulatory sources. So again, that's where I can't necessarily say that there's, that our measures are cover a module or cover an outcome 100%, because there's the description, the metrics, and the regulatory resources cover a lot of ground. And so it's kind of an art rather than a science about how much ground you need to cover with your metrics, because the they cover much more ground than even the recommended metrics cover. So if we could pull up the slide now, we can show the high level results of the coverage. All right, can folks see that? Hopefully. Okay, there we go. It's very tiny on my screen, so but hopefully you can all see it. The things that stand out here are the ones that are with the greatest coverage are obviously the claims processing outcomes, the encounter processing outcomes, and the financial management outcomes. So those are ones where we have hundreds of measures each to cover those, and that's because there's a lot to cover with those. It's like validating all of the data elements, the different data elements, and really the most important data elements from those claims and encounters and financial transactions. So often there's a separate measure to validate each critical data element. But then if you look at the other ones, pharmacy benefit manager, that is very claims related also. So there's a decent amount of coverage there. Prescription drug monitoring, it's all based on claims a lot. Third party liability, I think there's probably just not a lot of third party liability outcomes. So smaller denominator, bigger numerator. Eligibility and enrollment, 30%. That's actually pretty substantial. Long-term services and supports is only at 18%, and that is also because there's a lot of kind of processes, appeals and whatnot that are covered that T-MSIS doesn't reflect. But still, 18% is worth exploring. Member management, 18%. And then provider management. Again, that member management, probably some appeals process going on there that processes that can't be reflected in T-MSIS. And then provider management, 10%. And maybe that provider management in the future could be expanded on, and maybe that takes some enhancements to T-MSIS at some point in the future to bring T-MSIS more in line with MES certification. So there's probably an opportunity on both sides, states and CMS, to bring those into alignment. And so there's still, this isn't meant to be the end all be all. This was my take on it. There's like Michelle said, there can be state specific measures that get added, and so these are really just the existing national data quality, T-MSIS data quality measures that exist today. So there's a lot, and some, there's a few new ones, but this is probably 95% existing measures.
Steve, I mean, when I look at this, I see the percentages there. Like, that to me is reduced effort, reduced burden on a state, right? So encounter processing is 60%. I mean, if Steve, you came to me and said, your normal workday, I can make 30% of it, you are already reporting that, and that's already covered at 30% of your day, I'd be like, wow, thank you for everything. So that's tremendous. I feel like the other point that I want that really leaps off the page here is, when I think about T-MSIS, I think about the significant data quality efforts that states go through to maintain those files and to examine and look at it. And so the rigor that is going into T-MSIS data, states know, you all know really well for this. And so to not then use that data set that has that rigor brought to certification, it seems frankly like crazy not to leverage that, especially if you would be, in this case, spinning up some additional, like if you didn't use T-MSIS for encounter processing, or you didn't use T-MSIS for eligibility enrollment, now you have a different chunk of data that you're actually going to have to do data quality and work on and maintain that and track that. And so now you have, duplicates in some ways there, or maybe in a direct way. So I see this as both like just time and effort saving, this a big reduction in burden, but all of the effort that's going into T-MSIS already and has been for the last 10 years, it can is brought to the forefront with the data that's sent, right? If you are using T-MSIS data for any of these here, you know that is going through the rigorous data quality efforts that T-MSIS goes through. Like, again, think that's such a huge effort and time saver that I can see for states that are going through certification. That's what leaps off the page here to me.
Same. I agree with that.
Yeah.
Steve, I'm wondering if we can kind of move into your example of walking us through the mapping of the eligibility and enrollment module. And also just noting that we're at about 13 minutes left here or so. So I want to make sure that I give you ample time to go through your examples there.
Yeah, I'll try to go through them quickly. I got 3 examples, and so this is based on 3 outcomes in the eligibility and enrollment module, and I couldn't cover all of the possible outcomes in that module because there are 78 T-MSIS data quality measures mapped to the eligibility and enrollment module outcomes. So that 78 is obviously too much to go through, but I think I probably have maybe 8 or 9 that we can cover across 3 modules. And those 3 modules, again, are pretty targeted modules. Okay, so first example, this is the EE08 SSN verification outcome, and again, it's in the eligibility and enrollment, and we can see that the description is individuals are enrolled pending verification of SSN, and then the recommended metrics are the number of individuals enrolled pending verification of SSN, the number of people who remained enrolled under verification of SSN, and the upon verification of SSN, sorry, and then the number of people disenrolled for failure to verify SSN. And then we see the regulatory sources there, the Code of Federal Regulations. And then we see below that at the bottom of the screen, the existing T-MSIS measures, which either directly or indirectly cover some or all of those references. So the first one, EL1002-2, that's the T-MSIS data quality measure identifier, is for % of MSIS IDs with a verified SSN. And that's not currently used for OBA, but it could be in the future, especially if it aligns well with the SMC certification outcomes. That maps pretty closely to the second recommended metric that we see above. And then the next one is Rule 7182. So that is a data quality measure that is based on a T-MSIS validation rule. And the name of that measure is % of variable demographic segments where SSN is non-missing and invalid. That is an OBA measure. It's a high priority OBA measure in the category of beneficiary demographics. And it's more of an indirect relationship to the recommended metrics, but it ties more directly really to the regulatory sources. And then the third example here is the MIS 11515 measure, which is the % distinct MSIS IDs with only missing values in any active segment. And that's for the SSN verification flag data element, which is really right on the nose here. So they're at that has an OBA priority of medium status, so it doesn't affect OBA status on the map. The OBA status map, it doesn't change the OBA color of a state, but it's tied indirectly to the recommended metrics, but still very relevant here. So arguably, it can support this in complementing the other two measures. So if we remove the other two measures, I would say, you know, this missing this measure doesn't stand alone, but it can add, I think, to the confidence of the certification here. And then, of course, there's a potential to create more measures, but given that that's such a targeted outcome, I think that those measures could arguably satisfy the entire outcome. So I'm sorry, yeah, you can move on to example number 2. So example number 2 is for retroactive eligibility. And so the description is individuals receive timely and accurate determinations of eligibility for 3 months prior to the date of application if the individual would have been eligible and received Medicaid covered services. And obviously this is subject to change per the budget bill, but last I heard, I think it might be 2 months. So there still may be some retroactive eligibility even after that budget bill. So the recommended metric we have here is percentage of individuals who receive retroactive coverage up to 3 months prior to the date of application. And then the regulatory sources show the CFR, the Code of Federal Regulations, that support that and would be updated if the regulatory or if the budget bill were passed. So then what we have here, there's no existing T-MSIS measure for this, but there is the T-MSIS data can definitely support this. And so we've proposed possibly a new measure here that could be the percentage of MSIS IDs, which would be the denominator, reported with retroactive coverage up to 3 months prior to the application signature date. Now, that's a very oversimplification. It would be there would be a lot more nuance in the background we would have to develop, but definitely something that T-MSIS could definitely support. And since it's such a narrowly defined outcome, then it doesn't take many measures to really support that. We can move on to the next example. Maybe leave a little time for questions at the end. So then the third example here is for eligibility and enrollment notices. So I mentioned that some notices can't be verified by T-MSIS. This one has at least, oh no, here I'm looking at my notes and I'm not looking at the slides, and I've got them out of order. So I've been talking about the wrong ones. Actually, could we go back? So I've already talked about retroactive eligibility. Can we go back to example 2? You've probably been confused hearing me talk and not lining up there. So the notices, some of the notices, the EE10 is another eligibility and enrollment notice outcome. That one is the one that T-MSIS can't support because it's talking about the electronic format of the notices that isn't captured in T-MSIS. But there is an aspect of EE09, the notices outcome, that T-MSIS can support. So this one, the description is the individual receives system-generated, timely, automated eligibility notices and requests for additional information for eligibility determination as necessary. So that in and of itself is pretty vague, but then the recommended metrics, we have the percentage of notices automatically generated and sent. I'd say T-MSIS can't do that. Types of notices that are automated, types of notices that are manually generated, T-MSIS can't do that. But the last one, percentage of terminations due to lack of response to a notice, that T-MSIS does have some eligibility change reasons that will indicate whether a beneficiary's been disenrolled because they haven't responded to a notice. So that could be tied, that's a partial mapping to this outcome. And so we've got, what is it, three measures that that are mapped to that: the eligibility change reason frequency table. Did I put the wrong? I think I put the wrong existing measures on the wrong examples. Sorry, this is not lined up well. My apologies. But hopefully we'll be able to share these maybe somehow afterwards. But there's three measures, one of them based on a rule that do align here. Rather than cause more confusion, I think I'd better stop and allow some questions.
Thanks, Steve. And we definitely can send out the slides after the webinar, and you can make any corrections that you'd like to make.
Thank you.
Before we get those sent out. So I think we'll kind of move into a little bit of a wrap up here. And Michelle, I'm just going to kind of toss it to you about, how would a state figure out how to use T-MSIS data to support reporting certification outcomes? How do they figure out what do they do after that? So Michelle,
Yeah.
I'll toss this one over to you to kind of wrap us up here a little bit.
Yeah, I want to wrap up a little bit what Steve was saying too. And thanks, Steve, for walking us through that, because I did see the connection. I want people to understand that's a tiny little bit of what this mapping looks like. It's multi-pages of mappings. Directly, we use the intake form to do our mapping in. So you have your certification outcomes, and then we just added extra columns where excuse me, the T-MSIS measures can support those outcomes. If you are interested in continuing this discussion, reach out to me. I would love to continue this. We would love to continue this discussion with you. If you're interested in being part of a pilot to test the efficacy of using T-MSIS data and measures and reports to support your certification efforts, reach out to me. My contact information is in the slides, and you're going to get those slides. I want to be clear. We can have those discussions. We can talk about if you want to be a part of a pilot, we would love it. We would absolutely love it. If you decide you do want to do that, the next conversation is with CMS. Any pilot needs to be state driven. CMS is our very next contact. And we would love to have this discussion with you. We've spent a couple of years now, honestly, doing our homework, mapping this stuff, looking at the possibilities, how to alleviate that burden, following the messaging from CMS that Nick and I talked about. So we absolutely welcome a continued discussion with you.
And I'll just double down. Mathematica is a fantastic AWS partner. I love working with these folks mostly because they are so brilliant and connect all these dots together. That is what is awesome, and they're really doing something powerful here. And I think that they want to go on this journey with you all. Like Michelle said, reach out to Michelle. You can explore it more. Would love to stay connected, and just doubling down on, like, this is a great opportunity that I see, and an avenue to take advantage of what you states already have in that spirit of reuse.
Thanks, Nick. Thanks, Dan.
Thanks, Michelle. Thanks, Nick.
Yeah.
Michelle's
Thanks,
contact
everybody, for
information is
joining.
up here for anyone that wants it. We will send this out afterwards along with the slides. Steve's going to make some corrections, it sounds like, but we'll get this out so that you have Michelle's contact information.
Thank you, everyone, for joining us. And just if you just want something as simple as what we referenced, the documentation from CMS, just contact us. We will send you the links to that. It's public information and you can get it online, but we're happy to send you the links.
Great. All right. Thanks to everyone that's on the panel. Thanks for everyone that joined. As a reminder, once you close out of this meeting, you will get an Explorer pop-up or an internet pop-up with a short survey, just a 3-question survey about this presentation. Thanks so much for joining. Really appreciate your time.
Thank you.
Thanks, everybody.